Hi friends, today I am going to discuss about Glasgow Coma Scale scoring system. It is also abbreviated as GCS. It is helpful in emergency practice whether to take the decision of intubation or whether to use sedation or not. So generally this scale consists of a score between 3 to 15. The minimum score here is 3 and maximum score is 15. And it contains three components. One is eye opening response, and the other one is verbal response, and the other one is a motor response. So eye opening will have a maximum score of 1 to 4, and it includes again 4 components. That is, if eye opening is spontaneous or the patient is spontaneously opening the eyes, we give him a score of E4, and his opening eyes to verbal commands, we give him a score of 3, and he opens eye with to a painful stimulus, we will give him a score of 2, and there is no response and from there is no eye opening, we will give him a score of 1. So these are 4 different components in eye opening: spontaneous and opens to verbal command, opens to painful stimulus, and do not open. This is the range of eye opening scoring. Next, coming to verbal response. Verbal response again have under 5 components. If the patient has a normal oriented conversation, we will give him a score of 5. A confused verbal response gives him 4 points, and inappropriate, only words only, not he is unable to make sentences, only words, inappropriate words, we will give him a score of 3. And incomprehensive verbal response, that is sounds only, he is making some sounds which are incomprehensible, so we will give him a 2. And if there is no verbal response, we will give him a score of 1. Coming to motor response. Motor response is again having 6 components in it. If the patient is following our commands, obeying our commands, and we will give him a score of 6, that is the maximum score here. And if he localizes the pain, we will give him 5 points. And there is a withdrawal to pain, withdrawal or flexion to pain, we will give him a score of 4. Withdrawal response or flexion to pain, we will give him a score of 4. And if there is abnormal flexion or decorticate posturing, we will give him a score of 3. Abnormal flexion or decorticate posturing, we will give him a score of 3. It is also called decorticate posturing, and we will give him a score of 3. And if there is an extension to pain or decerebrate posturing, we will give him a score of 2. And if there is no motor response, the score will be 1. Even with very much painful stimuli, if there is no painful motor response, we will give him a score of 1. And based on this scoring, if the GCS score is 13 to 15, it indicates a mild brain injury. If it is if it is between 9 and 12, it is moderate brain injury, and if it is less than or equal to 8, it is considered as severe brain injury. And this one is NT, that means non-testable. If a component cannot be tested, we will consider it as non-testable. For suppose in the case of endotracheal intubation or tracheostomy, the verbal component of the score is denoted as non-testable or NT. There is another one called GCS-P, in which P stands for pupillary response to light. If pupils are unreactive to light, both pupils are unreactive to light, the score will be 2. If one pupil is unreactive to light, the score will be 1. Both are unreactive to light, the score will be 0. The pupillary score is subtracted from the GCS-P to get the GCS value.